George Xavier Love. I keep hearing your name frequently mentioned in metaphysical circles. What is it exactly that you do?
I'm a healer first. I'm a Qigong master second, primarily as an educator teaching health literacy and self-healing. Secondly, I'm a doctor of Oriental medicine.
What is that exactly, a doctor of Oriental medicine?
Well, Oriental medicine is an ancient, holistic, natural healing method that includes breathing, exercise, meditation, massage, food, herbs, and meridian therapy as tools in their medicine bag. A healer is responsible for creating the environment or circumstances by which or through which people heal themselves. I see myself as your coach and cheerleader, but you must run the race.
So what exactly is it that you heal?
Well, I specialize in chronic and degenerative disease, emotional stress, digestive disorders, and of course, pain.
And what is your process of healing?
Well, I heal people by identifying which system or systems are not flowing, and then I jumpstart your battery to balance or normalize your flow. Sickness is really stagnation of blood, lymph, or organ malfunction. Much the same way that your car needs regular tune-ups and maintenance, your body is a vehicle for your spirit and also needs regular maintenance.
So how would you do that?
Well, first, we fast. We use juice feasting to detoxify you for 3 to 21 days, depending upon the severity of the illness. Secondly, we evaluate the body, the emotions, the nutrition, and the will or your spirit. Thirdly, we change your mental outlook and ideas. Then we go to work on your body, and everything else just falls into place.
Okay, so let's start with the body first. How would you evaluate my body?
Well, Chinese medicine is based upon meridian therapy. Meridians carry electromagnetic energy. You can be taught to measure the flow of electromagnetic energy, which is called qi, by observing your face, your tongue, your posture, and pulses. Food and sex are the two biggest drives that are hardwired into your brain. Your activity around food and hormones will determine the major imbalances. Posture and physical shape determine the amount of energy you maintain. What I do is I feel your pulses. Pulses are rhythmical beats that tell us the stress and strain of your organs and systems. And you can observe your face and tongue on a daily basis to determine your internal conditions.
And what would be the easiest way to heal these?
Qigong is the absolute easiest way to heal.
Can you tell me a little more about Qigong?
Well, as I said earlier, qi is the electromagnetic energy that flows through your body, just like blood flows through the veins. Gong means mastery of. We use Qigong exercises to master your energy. There are 14 meridians in your body, and there are 14 exercises that activate the acupuncture meridians. They strengthen the joints, the bones, and the immune system. They also lower blood pressure, blood sugar, cholesterol, and we also use acupressure exercises called Dao Yin that stimulate your eyes and ears.
So actually, how would the application of Qigong have benefits here in the modern world?
Well, we can use Qigong as self-defense. We can use it as a spiritual balancing. We can also use it as moving meditation.
So what you're saying is it's good for self-defense. Would it be good for women?
Oh, absolutely. I do teach Qigong for cancer prevention. I use Qigong for lowering blood pressure, but I also use Qigong for self-defense for women.
And so would you recommend it for kids, maybe for teenagers, self-defense?
Oh, absolutely. I've worked with 8 to 10-year-olds, but I would love to work with teenagers.
That's great. So you're saying that if a teenage girl took classes with you of Qigong and learned a little more about Qigong, they could throw a big man like you around?
Absolutely. Once I teach them the self-defense moves, yeah, they could definitely throw me over.
And how receptive do you think they'll be, the younger community?
Let's find out.
That's great.
Let's go in the park and ask some teenagers.
So Dr. Love, can you tell me a little more about your acupressure, your ear acupressure?
Well, foot reflexology is something that everyone's familiar with. Ear reflexology is something that most people are not familiar with. Although ear reflexology has a longer track record, like 5,000 years, longer than foot reflexology. I call it earology because we diagnose and treat through the ear, which is a lot easier than taking your shoes and socks off in public and massaging your feet when you get a headache.
So why is it we haven't heard more about ear reflexology or acupressure?
Well, back in the 60s, there was a French medical physician, Dr. Philippe Nogier, who postulated that there were pressure points in the ear that corresponded to body points. And he envisioned an upside-down fetus superimposed upon the ear. Shortly after he published his book in 1960, the Chinese in 1962 published a book claiming that ear reflexology or auricular medicine was part of their culture and heritage 5,000 years. And every year since then, auricular medicine or ear acupuncture conferences have been held all over the world. So when you say, why don't we know more about it? It's because it's been stuck in the medical offices. I'm the first person to write a book about ear acupressure for the lay public.
I also read in your book that you mentioned about fasting. So many doctors and people recommend that it's not good for one. Why do you recommend it in your book?
Well, imagine somebody delivering groceries to your door every hour. By the time you finish putting the groceries away, there's another delivery. You never have time to put out the garbage. Fasting allows your body the time to put out the garbage. You only have so much energy each day. If you use it all to metabolize your constant intake of food, then you've got nothing left to process out the waste.
So how long would I have to fast for?
Well, it takes about 3 days for your stomach to shrink back to normal. So I usually start people with a 3-day fast. However, if you're familiar with fasting, I suggest that people do 7 days.
Wow, that's a lot.
And we do that when the seasons change. Now, the 3-day fast can be done once a month. The 7 days should be done the fall and the spring equinoxes and the summer and winter solstices.
So why would I have to fast when the season changes?
Well, at Christmas dinner, you don't eat what you eat on the 4th of July. And at Thanksgiving dinner, you don't eat what you have at Easter. So as the seasons change, our diets change. The purpose of fasting is to clean out the system to prepare for the new food. When you change the oil in your car, do you leave the dirty filter in?
Absolutely not, of course not.
So you've got to change your mental outlook at the same time.
So how and why would I go about changing my mental outlook?
Well, according to David Satcher, who is a MD and the former Surgeon General and Secretary of Health and Human Services, the definition of mental illness is the inability to care for oneself. It is your mind that makes you sick because of the choices that you made and your activities. And the mind that makes you sick is not the mind that can make you well. And that's why you need a guide or a coach, someone like me.
And how could I evaluate my emotions?
Well, emotions is another way of saying energy in motion, which is a self-protective mechanism. However, when they become states of stagnation, they're extremely harmful. You can evaluate your stagnant emotions by how long you remember staying in it. Anything longer than 24 hours is way too long. More than a year is pathological. Now, anger, frustration, and resentment are part of a complex that we call rage, and that injures the liver. Fear and anxiety injure the kidneys. Grief and a sense of loss weaken the lungs. Sadness and loneliness injure the heart. And worrying and over-contemplating, studying, analyzing things weakens the spleen. So if you are stuck in these emotional states for more than a week, you're definitely in trouble.
So then how would we go about treating our emotions?
Okay, once your emotions are stuck, they can be released. The easiest way is what I call the ER dance, or the emotional release dance. It's based upon shamanic Qigong and specific African rhythms. When you hear that drum music, you just have to move. It balances the brainwave patterns and relaxes your nervous system.
How does diet affect one's emotions and one's health?
Well, let's say you eat the standard American diet. Bacon and eggs for breakfast, ham and cheese for lunch, and steak for dinner.
Mm-hmm. What's wrong with that?
Well, it would take about an hour to explain how the poisons in the air, water, and soil affect your food. I'd have to explain how animals are raised and why meat is harmful. Further, I'd have to say that the standard American diet does not include enough fruits and vegetables. So I would have to say that I am pro-fruit and vegetable, not
Are you a
anti-meat.
vegetarian?
I've been a vegetarian for 30 years.
Excellent. For the medium fish eaters out there, how would one work on changing our eating habits?
Well, assuming that you're going to do a monthly fast, that would be the ideal time to change your diet. Fruits for breakfast, soup and salad for dinner, and eating small, frequent meals based upon food therapy. Now, food therapy is a diagnosis and treatment principle for all people. It's based upon a mixture of Ayurvedic medicine and traditional Chinese medicine.
And how can I learn to diagnose myself at home without going to see a doctor?
Well, I teach a course seasonally called 21 Days to Wellness. And you can access the information about that course at www.21daystowellness.com. Now, the course is either in a weekend format or a 4-night seminar during the week.
And how can I treat myself?
Well, in this course, you're going to learn about ear reflexology, acupressure, Meridian Qigong, Dao Yin exercises, food therapy, and herbal nutrition.
What, in your opinion, are the systems that tend to go out of balance, and what creates these degenerative diseases?
Well, electromagnetic energy that innervates the organs, the muscles, the nerves, and the flesh flows through the body in carefully defined pathways called meridians. Now, blood flows through the body in arteries, veins, and capillaries. Cerebrospinal fluid that lubricates the brains flows through something we call the dural tube that encases the spine. Thoughts and feelings flow through the body in hormones run by the endocrine system. Lymphatic fluid flows through the lymph system as part of the immune system. When any of these flows are disrupted, that's when you get dis-ease.
As in dis-ease.
As in
discomfort.
Disease, pain, tension, tightness. When you're a little kid and you get punched in the stomach in the schoolyard, you have a memory of that feeling and the muscular contractions that your body made when you got punched. As you got older, every threat to your safety or security recreates that same physical feeling of getting punched in the stomach. When you're a little kid and you pee in your pants because you're afraid of something, some traumatic event in your life, in your adult years, when something threatens you and makes you fearful or anxiety, your body reacts the same way that you did when you were a little kid. You tighten up the back of your legs and you compress the nerves around your spine. So everything that happens to us as adults actually originated in childhood. And it is that patterning of responses to the outside world that causes the diseases that we get as adults. Between the age of 35 and 54 is when these diseases manifest as symptoms. And when we get to be 55 plus, then we get sick, we go in the hospital, we end up on medication. The biggest predictor of illness at 55 plus is diet and lifestyle between age 18 and 34.
Oh dear.
Are you approaching 34?
Oh yes.
Okay.
Well, I thank you so much. It's been really interesting. You're a fascinating person. I know why your name keeps popping up all over the place.
Well, I've written 6 books, and I hope this information will intrigue you enough to check out the books that you can get on this website.
Thank you so much.
Thank you for having me.